for a more government-based single-payer system. I mean, I would agree that the businesses shouldn't be burdened with the responsibility of paying for their employees' health care. I mean, of course, like, you can't afford to hire more people if you're paying for their health care. It makes sense to me to shift that burden from employers to taxpayers. I mean, when you think about it, the money isn't going anywhere different. The money's going to pay for healthcare service. And as well, you'd probably be paying less because you're doing it collectively as a nation, instead of paying out of pocket to these private insurers who are gouging us as of now. I mean, just the reality of taxes, like, people get up in arms over taxing. Your money isn't going anywhere different. Your money is going to the same services. You're probably paying cheaper for those services. And in addition,
you're getting taxed deeper, right?
Yeah, I mean, of course, you're getting taxed to pay for this stuff, but money's still coming out of your pocket to go to healthcare companies, go to the government.
I mean, you'll be paying more for.
Well, no, I mean, if the nation is paying collectively, you're paying cheaper. You're paying less money to pay for collective service. It's the same reason why we pay so little for public schools or for police officers or for the fire department. We're paying less, and I think in the end that's like the true pro-business thing to do. If you want our businesses to be vibrant, take that burden off of them. That could be enacted in stages, but I mean, hopefully in the future that's the direction we're going in.
But
you look upset over that.
Well, I was just going to say that. I was just going to say that the insurance companies are still going to be. Well, I think it's going to be a mixed bag because they will be forced to provide insurance for people who.
They'll be forced to have so many more customers.
They will be forced to provide insurance for people who have. There's a reason why those people aren't insured right now. I mean, you can say, yeah, okay, well, the insurance companies aren't providing insurance for people who have pre-existing conditions. Like, let's say someone has a terminal illness. Well, it's going to be too expensive for. I mean, it's a sad thing to say, but this person with a terminal illness is going to be too expensive for the insurance companies to take on board. But now they will have to provide insurance for this person, which is good for the person. I mean, just like I said, like, insurance is good, health insurance is good, but how many of these people out there are going to have to be covered by these insurance companies? Because if they're if out of these 32 million people, these people, well, let's just say that I think it's a mixed bag at the end of the day because
for insurance companies.
What's that?
For insurance companies.
Right. Well, it's. I think it's uncertain right now.
Yeah.
Because although you get new customers, there's a reason why these people don't have insurance right now. Perhaps because they have pre-existing conditions, and when these insurance companies are forced to provide insurance for them, then they're going to not profit as much or not profit at all.
I'll say one thing. I'll let Bruce have the last word so we can get out of here. I forgot what my point was going to be. I think it's a bit naive to think that most of the people who don't have health insurance don't have it because they have, like, they're diseased people. I mean, these people don't have health insurance because they don't have the money to pay for it.
Right. Well, no, I would agree, but like the people who the insurance companies now have to cover, I'm sure that in its totality, if someone has a terminal illness, that person, the cost to the insurance company is going to be enormous compared to people who just can't necessarily afford insurance. Let's say you're just a poor person, but you're in relatively good health. That's how insurance actually works. That hopefully you get a nice pool of people. Some people, most people, won't necessarily need to use so much of the insurance's money, and some people will take up a large chunk of the insurance's money. But now you're increasing the number of people who will need to take up more of the insurance company's money, and by doing so, that's why I think that there's uncertainty over whether this will hurt insurance companies. Or benefit them.
So
there are two arguments there.
Also, there are tighter regulations for insurance companies, so that might hurt them as well.
You mean in terms of like pre-existing conditions and stuff?
Yeah.
That's how they make their money. It's by denying coverage. So it's yet to be seen. Maybe their programs are right. Maybe it will drive them out of business. One can only hope. First, nothing. Okay. And with that, we'll wrap up the inaugural episode of the Cubcast. From the Cub Pub staff, have a good day, and we hope you enjoyed the show.